Hello everyone, my name is Kirstien Minley and I'm a second-year medical student at OSU College of Osteopathic Medicine. Today I'm presenting on the evaluation of reporting of patient-reported outcomes in MDD, a meta-epidemiological study of clinical trials that I worked on with my colleagues listed below. Major depressive disorder affects more than 30 million U.S. adults and is expected to become the leading cause of disability by 2030. Moreover, the introduction of patient-reported outcomes within clinical trials have shown that patients who experience MDD have poorer quality of life outcomes than other chronic medical conditions like hypertension, cancer, and chronic pain. Given this, and that patient reports are largely relied upon for guiding the treatment of MDD, standardization of these self-reported outcomes is essential for clinicians to use them in guiding treatment. In response to this, the Consolidated Standards of Reporting Trials, also known as CONSORT, developed a patient reporting outcome extension in 2013 to help guide the standardization of these patient-reported outcome measures used in randomized control trials. It's unclear whether the randomized control trials concerning the treatment of MDD adhere to these CONSORT-PRO guidelines. Therefore, our primary objective was to investigate the completeness of reporting of patient-reported outcomes in RCTs related to major depressive disorder. Our methods: we developed a search strategy with the medical librarian and searched Embase, Medline, and the Cochrane Register of Controlled Trials via the Ovid interface for published RCTs regarding MDD. We limited RCTs between 2016 and 2020 that concern the management of MDD with one or more PRO measures as a primary or secondary outcome. From there, 2 investigators screened titles and abstracts using exclusion criteria in a masked duplicate manner. CONSORT-PRO completion and risk of bias appraisals were performed again by 2 investigators in a blind duplicate manner. So you can see here in our figure 1 that our initial records identified 2,608 potential articles. After removing duplicates, screening the abstracts for inclusion and full text eligibility, we were left with 49 RCTs for data extraction and analysis. Our Table 1 outlines the completion of CONSORT-PRO. As you can see, there are some inconsistencies in these items. The mean completion percent score for the CONSORT-PRO tool was only 56.74%. Moreover, RCTs with PROs as a secondary outcome were 15.35% less complete than PROs with a primary outcome, which was statistically significant. Some items also showed better adherence than others. For example, RCTs most consistently reported estimates of precision for their PRO data, item 17A11, while conversely, no RCT in our sample reported the domains of PRO tools to be investigated within their abstract. Of note, we found no relationship between risk of bias and CONSORT-PRO completion. In addition to these inconsistencies in CONSORT-PRO completion, we noticed heterogeneity in the tools being used. Among our study, there were 88 unique PRO measures used among the 49 RCTs. So overall, our results show that PRO reporting is inconsistent in MDD RCTs. Perhaps journal requirements for CONSORT-PRO may improve PRO completeness of reporting. Additionally, notable heterogeneity was observed across the PRO measures used in MDD RCTs. PRO heterogeneity may be minimized by the establishment of a core outcome set for the management of MDD. Thank you for your attention.